Hey everyone, Nikki here at the Truck Boss Show. We're joined by our good friend, Dr. Dixon, a medical examiner out of the TA Petro in Wildwood, Florida, with the Drivers Health Clinic. Thanks for joining us today, Dr. Dixon.
Thanks so much for having me.
Absolutely. We always love having you on the show. So, today we are going to talk about a subject that might not be talked about a lot, and maybe not a lot of drivers know about it, but it's really important. It is the importance of skincare. I know that, and you know that most of the time these drivers are exposed on their left side because, driving, we're on the left side over here in America, and it's just exposed all the time. And so, how often would you recommend they apply sunscreen?
That's a great topic. I'm glad you brought it up because so many of my drivers come in and they've got issues on that left side, and nobody really thinks about it. What you want to do is you want to definitely apply sunscreen daily. Every day before you start your day, go ahead and put on a UVA, UVB 15, SPF 15 or higher. If you're going to be outside for an extended period of time, or you're sweating, you're doing your onload, your offload, your tarping, whatever, you want to reapply it about every 2 hours because as you sweat, it comes off. So definitely go ahead and remember that, because you don't want to have, them cut stuff off of your arm and have to deal with it and have problems down the road.
Would you recommend the spray or the lotion, one over the other?
I don't really mind either one. I don't know that one's better than the other, but when you do use the spray, make sure that you're actually rubbing it in, because as you spray, you can leave lines. So just, you still want to make sure that you're rubbing it in.
Gotcha. So I know I see a lot of trucks that have UV tinted windows. Would you recommend that? And maybe how much tint should they get?
I definitely recommend it, but I recommend it as much as legally allowed, because each state has a different rule, and some states don't even allow it at all. So make sure you know the states in which you're running in and their laws, because some of them don't allow any and some allow up to 70%. So you definitely need to know where you're going. They can pull you over, they can actually make you rip it off right then and there if they really want to, and give you a ticket violation for tinting.
So then if they want to find out what their state's regulations are, just check out the website, which I will put in the comment thread for Oklahoma's. But if you are in another state, then just make sure you check out a similar site to find out what the regulation is for your state.
For sure.
So, absolutely. So, unfortunately, there is a thing called skin cancer, and we know that, the sun is strong, and having a lot of exposure to it can cause this. And so, what are some of the warning signs of skin cancer, and when should they go get checked?
Well, everybody should have a good checkup to start with, okay? And check up annually with a dermatologist. That dermatologist is going to go through head to toe, look at areas you're not going to think of that you can't see, look at your back. A lot of people have it on their ears and never think about their ears, right? So a dermatologist will go and map all of the moles and spots that you may have. So then you want to go up annually to make sure that nothing is changing. But what you are looking for, because nobody knows you like you, is looking for what they call an ugly duckling mole. So if you've got a few moles, but one looks really off and not like the rest, you want to look for that. Melanoma, there's what they call the A, B, C, D, E's of melanoma. So A is asymmetry. So if it's not like the rest of them, like we were saying, it's asymmetrical, you want to go ahead and note that. Border irregularity. So, if it's nice and round, but then all of a sudden the side's getting wonky and no longer in that border, you want to go ahead and check that out. C is color. So color variation. So, if they're all nice and brown, but then the side turns green or a different color, you want to look those out too. There are colorless skin cancers, so be aware of those as well. So if there's no pigment, but it's raised and it's white, but it doesn't look normal, then you want to look for those. And D is for diameter. So more than a quarter of an inch in size, and then E is for evolution or change. So if it was one size and now it's much bigger, or if it's changing color or changing anything, if a mole starts changing, you want to be aware of it and take it back to your dermatologist.
Gotcha. Well, once again, thank you so much for your expertise on this very important topic. And if anybody wants to find you, where can they go?
You can come to the TA in Wildwood. I'm right off the highway, and you can find me on Facebook, the Drivers Health Clinic. You can find me online, the drivershealthclinic.com, not the, just drivershealthclinic.com. You can always pick up a phone and call me. My phone number is 352-643-1034. And Nikki, I'm excited. In the near future, I should be having a few more offices. So hopefully we'll be able to help more of your drivers that are out there. Stay tuned because I'll let you know when those open.
Well, that is wonderful news and congratulations. And if you want to find more intriguing insight with Dr. Dixon, don't forget to check out our playlist extras on YouTube that you will find content that you're not going to find on the show. It's all great stuff. So until next time, we'll see you on the next Truck Boss Show.
Thanks so much.